Assalamu alaikum and good night to all. I am Dr. Nazdin Omer Jakia from NICVT Dhaka. I will share a case having a dilated cardiomyopathy. 9-month-old boy presented with recurrent RTI, having breathing difficulty, feeding difficulty, and echo done outside have been diagnosed as a case of dilated cardiomyopathy. And he came to our center for further evaluation. And he had tachycardia, tachypnea, and there was a pansystolic murmur at the apex. And her X-ray showing the cardiomegaly, and ECG showed normal sinus rhythm and normal axis, but there is deep Q wave in the anterolateral lead, that is lead 1, AVL, and V5 and V6. And this is the echocardiography and showing the peristernal short axis view. We can appreciate the coronaries only right coronary artery, which is seen dilated. And there is poor visualization of the left coronary artery from the left sinus. And in this view, we can see an unusual flow, abnormal flow arising from the pulmonary artery, that's the left posterior pulmonary sinus. And there is also flow reversal seen in the left coronary artery towards the pulmonary artery. It is visible as a blue flow. And in this apical four-chamber view, we can appreciate the hugely dilated LV, that is severe LV systolic dysfunction, grossly reduced ejection fraction, and there is moderate mitral regurgitation, and the papillary muscles are echo-bright because of the ischemic scarring of this papillary muscle. And we did cardiac catheterization, root aortogram showing only one coronary artery, right coronary artery arising from the right sinus, and there is no left coronary artery on the left sinus. With this, all these findings, we think about the anomalous origin of the left coronary artery
Nazneen,
from the pulmonary artery.
Aortic root? You have not done the aortic root?
Sorry, madam?
You showed only the pulmonary artery angio. You didn't show the aortic root.
Root aortogram. We did the aortogram, sir.
Yeah, show me that. Because when you do the pulmonary artery, you will not get, that's a low pressure, it will not go. You have to do the
Slide
selective.
is not moving. Can you help anyone?
Show us the aortic root and tell the diagnosis. We don't want the theory, just show your case.
Previous slide. No, not moving. Then this slide. This slide.
Yeah, the first one.
Yes.
The left one.
Slide is not moving.
Okay, that clinches the diagnosis.
Yes, ma'am.
Okay, so what was the clue that you got in the echo? You did not mention, that's the reason I'm asking. What was the clue that you got in the echo?
Slide is not moving.
There
Next slide.
There was a glistening
This is a slide
endocardium and the hyperechogenic papillary muscle.
Sorry,
And that was the clue that you get when you do the... Yes.
The diagnostic clue is
Yes.
poor visualization of left coronary artery from the left aortic sinus and dilatation of the right coronary artery from
Yes.
the right sinus.
Yes.
And there
Yes.
is gross LV dilatation and severe LV systolic dysfunction and moderate...
And you showed a very beautiful short axis, no, where the ALCAPA was very nicely seen.
Yeah.
So that was the...
And there is echo bright in the papillary muscle because of ischemic scarring of this papillary muscle, because left coronary artery is supplying the left side of the heart as well as mitral valve apparatus. That's why there is echo bright in the mitral
Nazneen, only
papillary
one
muscle.
learning point is, in case of ALCAPA, don't waste, when there is already LV dysfunction, don't waste the dye in the pulmonary artery. If at all, you do the selective angio, that's all.
Yeah.
ALCAPA is shown in the aortic root. Okay, thank you very much. That was a nice
Can I
case.
proceed, ma'am?
No, we'll go to the next.